Hi, honey.
Did anything come from
We'll just give it a few more minutes for people to arrive. Welcome, everyone. Welcome, everyone. I think we're going to go ahead and get started. So I want to welcome everyone to this discussion, a very important discussion. I'm Rachel Brasso, and I'm a general director with the NCJW, National Council of Jewish Women, San Francisco. Thank you for joining us for harnessing our united strength, mobilizing, staying informed, and advocating for reproductive rights in healthcare, which is aptly named a part of the Robin Brasso Social Justice Initiative. My mother was a fierce advocate for reproductive rights and believed wholeheartedly in advocacy and education. One thing I have also learned over the years is how important allies are. And it is my great honor to introduce a consummate ally, Representative Eric Swalwell, who was kind enough to record a video message for us since he couldn't be here live with us due to conflicts. Representative Eric Swalwell was raised in the East Bay. As a first-generation college student, he was an intern in the office of Congresswoman Ellen Tauscher. After receiving his law degree, he returned to the East Bay to serve as a prosecutor in the Alameda County District Attorney's Office, where he served for 7 years. He served as a chairman of the Dublin Heritage and Cultural Arts Commission, the Dublin Planning Commission, and was elected to the Dublin City Council. In 2012, Eric Swalwell was first elected to represent the East Bay in Congress. Now in his 6th term, he's working hard to bring new energy, ideas, and a problem-solving spirit to Congress, with a focus on advancing policies that support equality, opportunity, and security for California's 14th Congressional District. I'd like to introduce Mr. Swalwell.
Hey, thanks so much for that introduction, Rachel. I'm Congressman Eric Swalwell, and I represent the 14th Congressional District in the San Francisco Bay Area. I'm on the East Bay side, just across the Bay Bridge between San Jose and Oakland, and I'm so grateful to be a part of this event tonight. As you know, since the Dobbs decision, extremist elected officials have continued to undermine and attack women's reproductive freedom. They've pushed for a wide range of radical policies, from banning abortions in all 50 states to criminalizing doctors and nurses, to even threatening access to safe and effective FDA-approved medication. The consequences of these government-mandated pregnancies, and let's be clear, that's what they are, a government-mandated pregnancy. They're heartbreaking. Women's lives have been put at risk because providers fear being prosecuted for just doing their job. Women have been turned away from emergency rooms and denied care that's so essential to preserve their health and life. We are frustrated, we're upset, and we're angry. But there's one thing we're not. We're not helpless. That's why Congress must put into law everywhere in our land a codification of the Roe v. Wade decision so that every woman can access abortion care free from political interference, no matter where they live. So again, I want to thank the National Council of Jewish Women for your continued fight for women's reproductive freedom. And I promise you, I will continue to stand with each and every one of you against the continued attacks on freedom and women's health care.
It is, oh, pardon me, sorry, I lost that. It is now my honor to introduce our moderator for the afternoon, Bethany Golden. Bethany is an Actions Fellow at UCSF, a registered nurse and a certified nurse midwife who's practiced sexual and reproductive health for 20 years. As a clinician, a novice researcher, and a lecturer, she has worked in clinics, hospitals, universities, and villages in New York City, San Francisco Bay Area, Chicago, Fiji, and Nicaragua. As an Actions Fellow, Bethany has co-developed 3 reproductive health bills in California, collaborating closely with reproductive justice advocates, assembly members, and their staff. It's my pleasure to introduce Bethany.
Hello, everybody. Thank you so much for joining us this afternoon. I just want to say I am such a privilege to be here, and I'd love to introduce you to our esteemed panelists today. They represent New Orleans, St. Louis, San Francisco, and our Arizona chapters, as well as the national organization. And I have asked them to give us a brief update on abortion access in their state. And we're going to start with Gail Chalou, who is the president of the NCJW Greater New Orleans chapter, an editor and an activist. Recently sworn in as president, she specializes in editing academic books and articles, as well as committed volunteer work towards the betterment of the New Orleans Jewish community. A former editor of the New Orleans Jewish News, she also wrote extensively on the New Orleans Jewish community experiences during and after Katrina for the national press. The founding chair of Le Manifeste in New Orleans, Gail has guided its growth with its first 7 conferences, its biennial festival attracting hundreds of participants and engaging in learning opportunities throughout the years. Gail, if you'd be willing, we'd love to hear a little bit about what is currently going on in Louisiana and what issues and barriers are there for gaining access to abortion prescription medications, and reproductive health.
Thank you, Bethany, and thank you, Rebecca and Rachel, for inviting me here. Well, New Orleans is a very blue dot, but in a very red state. And the city's reputation is letting the good times roll and do what you wanna. It's actually very well deserved, but the rest of the state is very conservative and moralistic. And needless to say, even though people in New Orleans are progressive and the state legislature, which is more than 2/3 Republican, does not take the needs of our women here very seriously. And in fact, Louisiana had the distinction in 2016 of the highest percentage of voters who voted to elect Trump. So what makes the state even more unfriendly to abortion, to repro rights, is that it is very Catholic. It's a majority Catholic, unlike the rest of the South. So the right to abortion has always been challenged here. And as dire as the situation is now, it will get worse. Let me just backtrack. We were one of the trigger states, and as soon as Dobbs was decided, there were some legal machinations, but basically lost the right to abortion here. And we have a Democratic governor, but he is term limited, and most likely will not, a fellow Democrat will not succeed him. So that's why I say things may be even getting worse. Because one of the things that the governor did, even though he is a staunch Catholic himself, he was pushing in the legislature to have some exceptions to the total ban on abortion for rape, incest, endangering the mother, and none of that passed. The legislative session just ended about a week ago, and there were a few victories, most not, most were losses. We on the margins, we were able to work with other groups, and NCJW worked with other groups to help pass legislation that increased access to doula care, to midwifery, fertility preservation services, even for those women on Medicaid. And we were successful in preventing the passage of harmful legislation that would have enshrined fetal personhood into Louisiana tax law. As I said, none of the exceptions to the total ban passed. And I think this is going on across the country. The anti-abortion sentiment goes together with the anti-LGBTQ legislation, and we, NCJW, worked with other organizations to also fight them. But despite all of that, there's now a ban on medical professionals in Louisiana providing gender-affirming care for people under 18. Louisiana passed a version of the Don't Say Gay law from Florida, and teachers are, they are allowed to call their transgender students by their birth names and whatever. So advocating here for reproductive justice is an uphill battle. And I moved here from Baltimore, Maryland, about 25 years ago, and that is a blue state. And I can tell you, it's really hard and exhausting to live in a red state. I know Amy shares this as well. And it's hard not to get angry at the legislators who seem to be so backward. Yes, I've been president of NCJW for 3 days. And my overarching goal is to help mobilize. We have 800 plus members. Many of them are young. Many of the new members are young, and everyone is fighting mad about this. And we're going to be having an advocacy workshop that Shira will help lead with Alana from the national office in August, and that will kick off our hopefully an entire year of advocacy.
Great.
So,
thank you so much, Gail, for giving us that very detailed and important update about what's going on in New Orleans and Louisiana. Our next panelist is Rebecca Cormack. She is from the San Francisco chapter of NCJW. She's both the administrative and program coordinator. She holds a master's degree in public health with an emphasis in maternal and child health. She's passionate about health education and has worked at Planned Parenthood Gulf Coast as a community health educator, and continues to be a virtual health educator for Planned Parenthood's chat and text program. She also serves as the outreach and event coordinator for PS Test, a non-cost sexual healthcare clinic in Palm Springs, California. Rebecca, it's nice to see you, and I hope that you can tell us a little bit about what's going on in California and what issues and barriers there are here to access medication abortions and reproductive health in general.
Sure. Thanks, Bethany. And thank you everyone for being here. So California is kind of on the opposite side of the spectrum from Louisiana. It generally is a very protective state. Abortion is legal up to, I think, 24 to 26 weeks gestation. So usually around the time when the fetus becomes viable. And we have some additional protections. So Medi-Cal, which is California state Medicaid, and private insurance plans, they're both required to cover abortions. The state also gives protections for people who are trying to enter the abortion clinic to receive healthcare services if they're being harassed outside the clinic. So those are just a couple examples of what access looks like in California. And obviously, in any state, there's disparities in terms of who gets to have access and who has easier access than others. There's data from 2017 that shows that 40% of the counties in California did not have an abortion provider in that county. So that leaves out a significant portion of the population from having easy, quick access to a provider. Medication abortion is legal here, which can help prevent that barrier. It can be sent in the state. So that's a good thing. And in California as well, there are about 9 million women of reproductive age. So ages 15 to 49, give or take. And about 44% are Hispanic and 16% are Asian and 5% are Black. So we have about 65% of women of reproductive age in California are identifying as women of color. And we know that in general in this country, if you're a person of color, you're less likely to have healthcare coverage. In California, there's still about 7.5% of people who are uninsured. You're also more likely to live in a more rural area and therefore have less access to healthcare services in general. English might not be your first language. It goes on and on. So these disparities can create access barriers to care, even though we are in a relatively protective state. And just like in any other state, there's always going to be people who oppose abortion, people who are trying to take away women's rights, just reproductive rights and healthcare access in general. So even in California, I think it's still really important to recognize what rights we do have and then fight to ensure that these rights are still protected for many years to come.
Thank you, Rebecca. We'll find out a little bit now about what is happening in Missouri in St. Louis chapter. Amy Kuo Hammerman is here. She is a full-time feminist homemaker, community organizer and activist, and a family law attorney on an extended hiatus. She is a member of the board of Congregational Sharia Imeth, where also she serves as the co-chair of the Racial Equity and Diversity Inclusion Committee. Amy, thanks for being with us. And I just want to make sure that the questions are the same, just to sort of give us a up-to-date status report on what's going on in Missouri and the barriers that you see to access to both abortions as well as medical abortions and reproductive health services, both in St. Louis and beyond.
Yeah, thank you, Bethany. So in Missouri, we've had starting in 2019, we had an 8-week abortion ban that didn't have any practical exceptions. So when the Dobbs decision came down last year, the actual state of access to abortion in our state didn't change that much. And despite that fact, our Attorney General was very loud and proud to be the very first to implement our trigger ban. And he was on his way to running for Senate. So that's sort of where we are politically in our state. Currently, we have a nearly complete abortion ban. We do have an extremely narrow exception to save the life of the pregnant person, but at least initially, that was met with a huge amount of confusion among medical providers. It created an instantaneous chilling effect to the point where we had pregnant people becoming septic, having to travel out of state days after initial pregnancy complications. And our understanding from medical providers now is that a lot of the hospital systems have sort of gotten their act together to continue to provide care, not for abortions specifically, but to provide basic maternal health care, which does include, for all intents and purposes, terminations of pregnancies. But for the most part, our pregnant folks or folks who need abortion care do have to travel out of state. And access to even basic reproductive health care, particularly for low-income people, has continued to be an issue, aside from the fact that Planned Parenthood has continually been defunded by our state legislature, in the sense that they will not cover or provide Medicaid reimbursements for non-abortion care related reproductive health care. They go to court over and over every year. It's declared unconstitutional, and our legislature does it again. And on top of that, we have a pretty severe rural healthcare crisis. And we had hoped that would somewhat be alleviated by finally expanding Medicaid in our state by initiative petition. But again, it takes a while for hospital systems to go back to the places that they fled, and healthcare needs continue. At the moment, we are doing our best to support providers in our surrounding states. So I'm in St. Louis, and we have partnered with both Planned Parenthood and a fantastic independent clinic just on the Illinois side of the Mississippi River called the Hope Clinic. And at least in terms of NCJW, for practical support, we've partnered with them to do things like provide care and support packages for the many people who travel to those clinics. Everything from providing clothes to change into, to snacks and pads after procedures and things like that. But we continue to do our best in the advocacy realm to raise awareness about abortion, to try to change the culture around abortion in our state. So we have been doing a lot of our focus has been on education, in sharing abortion stories, and I can talk more about that later. But really, our feeling is, if we don't change the culture around abortion in our state, we're just going to continue to see even more of an erosion of the concept of access to reproductive care. And that's kind of where we are right now with the legislature that we have.
Thank you, Amy. We're going to hear now a little bit about what's going on in Arizona. Sylvia Tamarkin is an award-winning investigative journalist, documentary filmmaker, and former television news executive. She formerly was a CNN executive and an executive producer of CNN's Emmy Award weekly news magazine show CNN and Time. She produced investigative segments and series for ABC World News Tonight, half-hour specials for Nightline, and contributed to ABC's coverage of major news stories. She's a filmmaker of the 2017 documentary Birthright, a war story which foreshadowed and warned of the end of Roe. Thank you, Sylvia, for being with us tonight. Can you tell us a little bit about what's going on the ground in Arizona and how the barriers to access to abortion and medical abortion and reproductive health care is the state of it in Arizona?
Thank you. And thank you for having all of us. Arizona has always been ground zero, test piloting so many of the abortion bans that then appeared in other states. We were among the first states to introduce mandatory sonograms, waiting periods, and because of a two extremely dangerous groups that are based here. One is Alliance Defending Freedom, an organization most of you will know, that files suits against LGBTQ rights and abortion. And also because we have a group here, the Center for Arizona Policy, which is a very conservative group, and they literally test run bills from National Abortion Right to Life and other conservative groups, we have been battling more than 40 restrictive bills for years. However, in 2021, the goal has not been to outright ban it because this state has a majority of people who would not support that. What they have been trying to do, as across the country, is whittle away. So in 2021, they passed a reason ban, which precluded abortions for reason of genetic anomalies. A provision of that was also a personhood law. We immediately, NCJW, challenged that in court. We filed suit. We had co-plaintiffs. We strategically formed an alliance with the Arizona Medical Association, 2 physicians, and the Arizona section of NOW. And we challenged that. We won an injunction. However, when the Dobbs decision came down a week later, the Supreme Court lifted our injunction. That case is now in the Ninth Circuit, and we expect arguments in September. However, as a result of Dobbs, abortions shut down in this state because the then Republican Attorney General invoked an 1864 territorial ban, which precluded any abortions. It was part of the old Comstock laws. And even though that was later enjoined on appeal, what went into effect was a 15-week ban that had passed the legislature only a few weeks before the Dobbs decision. However, even with 15 weeks, nobody would perform abortions because this personhood law was still hanging over everybody. So there was fear of criminal penalties for providers, even potentially for people who were pregnant. Fortunately, 1 month after the Dobbs decision, we won an injunction against that personhood law, which enabled terminations in Arizona up to 15 weeks. The problem that we're seeing here is most detrimental for those who are facing mismanagement as a result of this 15-week ban. Hospitals in Arizona now have legal panels determining how close to death the pregnant person may be before there can be an intervention. Fortunately, even though we still have a Republican-dominated legislature, but by a thinner margin, we did elect a Democratic Attorney General and a Democratic governor. So very fortunately, we had 40 bills vetoed this session, and we have worked very hard to present the talking points for those vetoes because many of them were backdoor attempts at personhood. Seemingly innocuous, almost laughable to allow pregnant people to drive in an HOV lane, but it isn't because it's a backdoor attempt, allowing tax exemptions for pregnant persons, the same type of thing. So we've been working very hard to make sure that these entrees to personhood were vetoed. And we go to court in September. The Attorney General, the Democratic Attorney General in this state, will not defend the law. But what happened now is the Republican president of the Arizona Senate and the Republican Speaker of the House, represented by Alliance Defending Freedom, have filed to be interveners in this case. So they are representing the interests of Arizona when we go to court in September.
Thank you. I think that, what goes on in Arizona is so critical in terms of, again, as you're talking about trying out new ways of creating more barriers, access, and denial of rights. So thank you for laying that out for us. Moving on to Shira Zemel, who's is our co-director on the federal level, Abortion Access Campaign co-director at the National Council of Jewish Women. and has coordinated the Jewish movement for reproductive health, rights, and justice for the organization. In this role, she activates and mobilizes the Jewish community nationwide to take action for abortion access. And she serves on the Arch Board, a local abortion fund serving patients seeking care in Northern Virginia. Welcome, Shira. Would you be willing to answer the questions on what's going on from your vantage point?
Absolutely. And hi, everyone. I'm so excited to be here, and I love the opportunities to come together with section leaders across the country. I continue, 18 months into my role, I continue to be amazed by the work that's our section, you all are doing, and learn so much from each of you. And yeah, I'm happy to share a national perspective and what we're working on at a federal level and in the work with our campaign. So we work with our sections across the country, educate and activate our Jewish constituencies nationwide, including clergy and future clergy, our rabbis for repro, to work to expand access for all. I think you've heard really clearly of the different fights at different states. And so building up the leadership, right, with Rabbis for Repro and working to connect the work of our sections is clear. We really are grounded in the reclaiming the narrative and the culture change work that Amy spoke to. Jewish and being in the public square, reclaiming the narrative around religion and abortion, that Jewish tradition is clear, and that abortion is permitted and sometimes even required when the life of the pregnant person is at stake. So we do this in so many ways. And what, to talk about what's happening at the federal level, to the question, we're advocating all avenues in Congress. If the Dobbs decision taught us anything, is that this is a threat to any person who ever wants to be pregnant, not just people who are pregnant, but anyone who ever wants to be pregnant, and the people who love people who may want to be pregnant, and really a threat to all families. So we need to pursue all avenues. Contraception, the threats to contraception, the Black maternal health crisis, our data on the internet being used and weaponized against us, abortion disinformation through crisis pregnancy centers. We're looking at all levers in Congress, and it's still a new Congress. Bills are being introduced. I can share more later in the call about some of these pieces of legislation. Also a comprehensive and thoughtful litigation strategy. Civia, what the work that's happening in Arizona filing suit is incredible. And my colleague Smriti here in the national office works closely with the Columbia Law and Religion Project on pursuing religious freedom arguments, filing amicus briefs in the federal courts. Obviously, I don't have to tell NCJW section leaders about our courts matter work and ensuring that we have a fair and independent qualified judiciary, because we see the way that the courts are critical in the fight. And I think, the threats to medication abortion with the case out of Texas that's back in the Fifth Circuit, we could talk more about that, but raising awareness around medication abortion, expanding access to it. We work closely with our reproductive justice partners and our interfaith partners, and just continuing to make sure access includes making sure patients have access to care, funding encouraging folks to fund their local abortion funds, and also our Jewish Fund for Abortion access, and creating critical moments for the Jewish community to come together and raise our moral voice and lead the interfaith community, but bring the Jewish community to the larger repro movement. And all of it is critical. And just thank you all for your leadership, and happy to be here.
Thank you so much, Shira. I'm going to put some questions to the panel in general. And one of the ones I think that is really on folks' mind is what are our effective strategies, and how does your chapter employ effective advocacy strategies. How is your chapter working on policy efforts and elections? And I think that we've talked about sort of some successes and some losses, but how does the mechanics actually work in your chapter? So people who want to deepen their involvement, what is an effective approach if you are joining in this, joining not only this chapter's efforts, but either on an individual level or within the group? Rebecca, would you like to start?
Yeah, I'm happy to start. So I represent NCJW San Francisco, and in San Francisco, we have a policy committee, and this committee is focused on really just maintaining awareness of the policies that are being voted on in the state and locally as well in San Francisco or Bay Area in general. And so just this past May, our policy committee was making appointments with elected officials to discuss bills that are of importance to us. And one of the bills that we identified this spring is SB 36, which is authored by Senator Skinner, who was our award recipient this year for Outstanding Visionary and Human Rights Advocate. So that was cool. And basically what her bill does is it gives protections to people coming to California from states that have criminalized abortions or have criminalized gender affirming healthcare. So it kind of loops the two together. And basically it would make it illegal for people outside of California to apprehend people who come to California seeking such care. And since NCJW San Francisco's lobbying efforts last month, or just kind of over the past month, SB 36 has been amended. So parts of it are now part of SB 345. And right now, SB 345, I think it was read in the Assembly on the 1st of June, and then SB 36 is still being held in the Senate Appropriations Committee. So it's something to keep your eye on if you're in California and you're interested. And if you're also interested in getting involved in our policy committee, you can email me. I can put my email in the chat and then I'll get you, put you in touch with the right people. And then just in terms of another initiative we've been doing that's not policy related, is the post-abortion care package making events. I believe a few other sections of NCJW have done the same thing. And we did our first at the beginning of April with Congregation Beth Am, and then we're having our second one next Wednesday evening at Peninsula Temple Beth El. So the first event we packaged around 200 kits and we delivered them to 3 different abortion clinics in the Bay Area. And we also made some provider care packages just to show our appreciation. We wrote them thank you notes. It's just a way of standing in solidarity with the providers that are doing the work, and also to tell people like, hey, we support you in your decision. Whatever decision you make for your health is your decision, and we are supportive of that. So yeah, those are just 2 of our initiatives.
For some of our audience that may not be familiar with an abortion kit for a patient, can you tell us a little bit about what was in that kit?
Yes, so we decided to put little chocolates just to make people feel good, some tea bags. We also put maxi pads in there, and like instant hot packs, and that was just to be like kind of a comforting item to put on themselves while they're recovering.
Great, thank you. Amy, would you like to share any effective strategies you think for advocacy that you've learned in your time?
Sure. To the extent that the strange politics of Missouri can be compare to any other state. One of the most effective strategies that we've had is to work in coalition. So, for example, NCJW works in coalition with pro-choice organizations like Pro-Choice Missouri, with Planned Parenthood advocates, with, and we have a very close relationship with the Missouri Family Health Council. And the reason why I say that this is effective is because each organization has its own style. of advocacy. So, for example, Pro-Choice Missouri and Planned Parenthood have seen an upsurge, I would say, in Gen Z volunteers, which is great. Lots of very energized young people. They do often take, I would say, a louder approach or more outspoken, and some might argue an aggressive approach. For example, they wear T-shirts and carry signs in the hall when we're at testifying against bills that say F abortion bans. By contrast, at NCJW, our advocates don't tend to be outspoken in that particular way, which is not to say that we are not outspoken. That said, we tend to take, maybe some might view it as a quieter approach. We do meet with legislators privately to express our concerns. We show up and we testify in the exact formal way that we are expected to testify. And as a result, that does allow us to get into some doors of legislators who would unfortunately not give the time of day to Pro-Choice Missouri, not because they don't deserve to be in there, but because they're afraid. And when a group of nice Jewish ladies shows up and says, oh, actually, we're not here to talk about Israel, we're not here to talk about reproductive health care, it's a different vibe, as the kids might say. And so I feel like this is effective because we need both. We need folks who are making a lot of noise and expressing the righteous anger that we frankly all feel, in order to get the point across. But we also need folks like us and Missouri Family Health Council who are able to say, okay, we're in coalition, we're all on the same team, we have a different approach, we're not going to yell at you. And so we found that to be pretty effective. Aside from those kind of direct advocacy strategies, we're doing a lot of like consciousness raising. And I talked before about trying to shift the culture. So a lot of our education has to do with just putting human faces to abortion. Because frankly, in much of our state, and now I'm not even talking about like the middle of the state that's rural, even in St. Louis County, which is about as suburban as you get, people won't say abortion, they'll say abortion, like it's a bad word. And we are trying to make that change, just to destigmatize it. And for those of you who are in San Francisco, we did partner with a photographer named Rosalind Banish. She has a photography exhibit called Focus on Abortion. It consists of 19 stories and 19 beautiful photographs of people who have had abortion and tell their stories. People, and I can say we saw it at Washington Institute, W National, and we brought it to St. Louis. It was hosted at my congregation, and I can tell you that it made a huge impact for folks. So I can, if I'm not too internet stupid, I'll put the link to her website in the chat. In terms of other strategies, we're also working in coalition with, well, not so much in we are supporting two groups, Amerited and the National Women's Law Center. They filed a lawsuit in the city of St. Louis to challenge our abortion ban. It's based on the Establishment Clause of the First Amendment, which differs from some of the other lawsuits based on the First Amendment that we've seen in other states. What's odd about Missouri is we have a particularly strong Establishment Clause, and that clause says that the government shall not establish a religion, and religion doesn't just mean freedom to exercise your religion, and that is part of the lawsuit, but it's just as equally freedom from a religion being imposed on us. And I think we've seen in many states, but particularly in Missouri, our legislators were not shy about the very specific religious motivating factor that they had in passing our abortion ban. So, a group of, I believe now 14 clergy, many of them are, I guess I would say 5 of the 14 are rabbis. I'm proud to say 2 of them are my rabbis. But we're, as NCJW, we are there to support their efforts by publicizing what's going on with the lawsuit, the basis of the lawsuit, and why it's important, particularly in the Jewish community, but also joining in an interfaith effort so that the concept faith isn't hijacked by a very narrow viewpoint. And we're currently in a sort of a holding pattern right now, but Missouri does have an efforts in process to get a initiative petition going to establish a constitutional amendment that would protect the right to reproductive freedom. We have a lot of bureaucratic and administrative shenanigans that are of the anti-abortion elected officials that we have in the Secretary of State and the Attorney General. But those are the kinds of things that we're doing with the initiative petition. It's a pretty broad coalition of folks, not just repro organizations that are planning to work on that. So, you know, you kind of just have to do everything all the time. There's no rest for the weary.
Thank you, Amy. I think that coalition building and what you're speaking of sort of like unique legal strategies that really bring to heart like that there's sort of solutions that we haven't necessarily thought of that are maybe very unique to specific locations and specific state constitutions. And we've seen how state constitutions have upheld the right to abortion in states where we haven't expected it. So that is such a critical strategy, and clearly you guys are taking it even further. Just so you know, in the chat, someone was asking if they could have a link to that brief or have more information about that specific legal case that you guys are working on. Gail, would you like to speak to any specific strategies that that you've encountered that you think are particularly effective at this time?
Sure. Yeah, I agree with Amy that the culture is very important, and but the culture, the anti-abortion culture in Louisiana is really strong. And though we've worked in coalition with other groups, we're also doing approaching the issue from a whole nother direction, which is increasing voter registration and voter turnout, so that in those, at least in New Orleans, we can have a bigger role in statewide elections. And we created a citywide coalition for voter registration, and they've registered like 12,000 people. This has been over a couple of years, and they go to all the high schools. These are all volunteers. We work with League of Women Voters and lots of organizations, but they go to every citizenship ceremony and get the new citizens to register. And it actually, and alongside that, there is a citywide, it's called Together New Orleans, with about several hundred nonprofits in the area. And they had they're focused on getting the vote out. And when our Democratic governor was running the second time, he was in a runoff with a guy candidate who was even to the right of Trump. And this Together New Orleans really mobilized Democratic voters, and many of our volunteers were block captains, and they were responsible for, getting the people on their block to get out to vote. And fortunately, he won. And this was before the pandemic. I don't know who, and he was wonderful during that in terms of enforcing, mask mandates. And I just shudder to think if he hadn't been elected, what would have happened. So, yeah, and it's a really pretty easy ask to ask people to be involved, particularly in registering voters. And, so this has been really successful for us.
Great, thank you. It's so, as we know, voter registration is so closely tied to, again, not only participation, but making sure that we're getting people in positions of power who are champions of reproductive justice. Sylvia, do you have some comments? I think that you spoke very well about fighting personhood in all of its shapes and forms. But I do, what other strategies do you think are?
Well, we do. I mean, I strongly and firmly tell everybody to be part of stakeholder coalitions. Our focus here, awareness has long been on the agenda of this section. In fact, that's how I came to this section. It was when my film was in theaters in Arizona when NCJW Arizona approached me. And that was when I first became involved because I saw it as a very powerful platform to accomplish the goals. What we do is we're part of a small but mighty stakeholder coalition, and that includes American ACLU, Planned Parenthood, ourselves, Equality Arizona, and NARO, and ACOG, American College of Obstetrics and Gynecology. And we have weekly meetings where we address what bills are coming up and we strategize how to approach these bills, what talking points we should give legislators, and how to combat it. And we very often take a very different approach. We don't argue very often from the point of reproductive rights. We look at it strategically. So for example, a year ago, there was a bill introduced that would ban methotrexate. What we did was bring in oncologists, variety of various physicians who testified that methotrexate is also used for brain cancer, for endometriosis, for Cushing's disease, for other illnesses, and that if you ban the drug, you are interrupting the supply line, the distribution for people who need access for other medical conditions. And we not only got defeated, we got defeated because we had 3 Republicans cross over and vote it down. So that's what we do strategically. We look at whether bills are going to affect the larger picture in terms of health care and the repercussions and the collateral damage of it. We're not in there just dealing with abortion rights, but the larger picture. And we work closely with Equality Arizona and other LGBTQ groups because we too oppose bans on transgender girls in sports, bans on gender affirming medication for minors, etc. So we are involved from the policy and legislative. Fortunately, we sit on the governor's Women's Health Policy Committee. And now we are one of the few organizations that are involved in drafting, and we will be launching a ballot initiative for 2024, which will be a constitutional amendment.
Thank you. I think that level of engagement and that level of involvement, and again, looking at these problems holistically of not only what the attempt is, but how the larger, what's at stake in a much larger realm, in a much larger sphere. Great strategies. Shira, national strategies that we can use locally, or local strategies used nationally?
Yeah, I'm going to talk to a few things, and also I'm seeing Annie's question in the chat, so I'll try to address that as well from my vantage. So, you know, I mean, I think that I can draw dotted lines between a lot of the strategies that we're hearing, and I also just want to lift up the importance of coalition that we've already heard Sylvia and Amy speak to. We're obviously sitting on doing the same work at a national level, both the interfaith repro coalitions. Annie, I'll get to finding local interfaith partners in a second, and the larger reproductive health rights and justice coalitions. And, you know, we're stronger to, I don't feel like I need to make the case, but we're stronger together. And it's, I think also a really key part I want to lift up around the coalition work is that how the coalitions help us keep those most impacted by abortion bans, those with limited financial means, Black, Indigenous, people of color communities, immigrants, disabled people, trans and non-binary people front and center in the work, by bringing diverse coalitions together to that want to address the work in lockstep. That work is about relationships first, and it can be complicated, and it's slower sometimes to really be working on it, building coalitions with deep relationships, partnerships, and trust. But it is critical. And so hearing, my colleagues, the different sections speak to building relationships with local clinics, all of it, providers, doctors. I mean, this is the reproductive justice led groups. This is all critical into the strategy. And so I will say that just big takeaway, relationship first, and really spending the time to do that. The work is stronger in partnership. In terms of I think, I want to also lift up the consciousness raising. I can't tell you, one of the first things we did when we launched the campaign was send out yard signs and banners to our sections across the country, synagogues across the country, JCCs, you name it, anyone who was willing to receive it, we sent it, we can still send it. I can't tell you how many emails that we receive in a week. Oh, I was here so-and-so in Washington State, or I was there. I mean, I saw this banner, National Council of Jewish Women. I maybe vaguely familiar or not. How can I get connected? Making connections with local sections if there is one, and getting folks connected to the national campaign. So I think consciousness raising, this is a moment where some of you have been fighting this for decades, and some people are just waking up, and I can't speak to what a loss it is that it took, taking away a fundamental right at a federal level, to have some people just wake up to the urgency of the moment. But we're here, and we want everyone to join, and we're creating on-ramps and inflection points for everyone. And so whether that be, when I think about like the plaintiffs in the St. Louis case, all the rabbi plaintiffs are rabbis for repro. And I think about the many clergy that I talk to across the country. They're all on a journey becoming leaders of reproductive freedom. And so in their local communities. And so for some, that means stopping using euphemisms from the pulpit of women's choice and, and saying the word abortion and destigmatizing in their community to help make sure abortion care is free from shame and stigma. And so I think the consciousness raising piece, I don't want to lose sight of that. And then just, the deep strategy work, we heard Sylvia speak to, that's happening within local coalitions to, fight these from a state level, and doing what, we're doing, and the San Francisco section is doing, of bringing these best practices and lessons to the table, because the antis are creative. And so what a strategy that works somewhere, we see quickly get exported to a different state. And so, just being a network I think this is powerful. To the questions in the chat, I'll say that, Annie, I don't know where you are, but I'll drop my email in here. And if my co-director Glenn knows about the local interfaith groups that might already exist, tapping you in. We work with RC, we work with Interfaith, Repro.org, Sacred, RC. I'm forgetting what someone knows here what the acronym is. Religious Coalition for Reproductive Choice. Thank you. So I'm happy to tap folks in and help make those connections. And to teens, I think, Sivi, you have a great story of just one example, but I could talk about many where getting into the Jewish communal organizations, institutions across the country. We're partnered with Moving Traditions, the different youth movements, Habonim Dror, Nifty, Young, we're working with the Jewish summer camps. The decision came down last summer when Jewish summer camps were up and running across the country. And so we sent the same materials and programmatic materials to the camps. This is a loss for young camp counselors, for young people. They lost their rights too. And we have camps all over the country, Texas, everywhere. So I'll just say one last thing in terms of where we're headed. The creating the Jewish communal moments for the to reclaim the narrative around religion and abortion in the interfaith moments, to give people faith language, to take that away, that power away from the religious right. I think that's critical. So for the anniversary of the Dobbs decision, the decision that overturned Roe, we're coming together as a Jewish and interfaith movement to create a religious moment of mourning. I'm dropping a link in the chat so that I can save time, but happy to take follow-up over email for folks to get engaged. We're having a virtual gathering on the 23rd at 1 p.m. To honor this as a yard site, and happy to talk about it more and drop the link in the chat.
Thanks, Shira. I think that a couple of strategies that really are worth noting, centering the voices of marginalized groups and amplifying them is probably one of the most important things. I've been on the Future of Abortion Council. We got 15 laws through last year. We're going to get 17 laws through. We're on the offense. A lot of you guys are on the defense. Based on where you live. And our offense is very much tailored to the needs of those who have gone unheard, unrecognized, and underserved for a long, long time. And their leadership is what is the voice in these bills. And I think that just keep recognizing the powerful leadership that women of color bring in every setting, and making sure that those are the talking points, not perceived talking points, is really, really critical. The other thing is that some states have been dealing with very sophisticated trap laws for a long time. So if you're a new state that now just recently has developed trap laws, reaching out to chapters in states that have already been battling this for decades is really important. When we were meeting prior to the audience coming into the Zoom, Amy was speaking to the fact that Missouri has been in a defensive position for a long time with an 8-week ban already in place, and therefore strategies like building a 20,000 square foot facility on the other side of the river in Illinois was very much on folks' mind. So, if you sort of feel like your chapter is new to this, reach out to other chapters which may have a little more experience, and sort of describe the situations that you're seeing and how best practices and past experiences, we can be informed by those. Thank you everybody for your questions. Feel free to keep putting questions in the chat and we will respond to them as we go. The next question for our panelists is, if we're going to sort of mobilize new groups of people into the reproductive rights and justice movement, what do you think is the most effective way to do that? And I think we started to speak a little bit about how really youth and teen are critical to that. Interfaith partnerships are critical to that. But how do we also mobilize people who have traditionally not seen this as their issue? I'm curious, and if the panelists have any comments for that.
I'm happy to pop in about that.
Thanks, Amy.
One thing that we don't talk about enough is mobilizing men. Period. I was fortunate to be able to participate in one of our local synagogues, Repro Shabbat. They did a really great Kiddush lunch and learn, where I got to talk about basically what I'm talking about here. And there were a lot of men there. And they asked me, what can we do? And I told them, talk about abortion. Say the word abortion, talk about abortion to your buddies, talk about abortion when you're going to golf, talk about abortion and why it's important to you, not just from the perspective of, oh, because I have a wife and because I have a daughter, which is very important, but also because there's no need for abortion if they're without men being involved somehow. We don't have immaculate conception. And we've been broaching it a lot with men in terms of a personal autonomy issue, because that's really sort of bottom line what this is about. And even though men may never actually have, at least cisgendered men never have the risk of becoming pregnant, one, they have the risk of getting someone pregnant, and two, no one wants the government between them and their physician. or other medical provider. And the idea of personal autonomy and freedom and liberty, that's a big buzzword for us here in Missouri. That's one way to do it. And because frankly, if we don't get men just as upset about this as we are, we're really, not getting anywhere.
Exactly. Yeah. I would like to echo what Amy said, because we do a lot of speaking to youth groups, and we focus on the young men in the group and point out, number one, from a liability perspective, in many states, if you impregnate someone and they are forced to carry that fetus to term to full birth, then you are responsible, or your family is responsible, for child support until you're 21. This is not something you can just walk away from in many states. There's also a very effective group that's starting to get going. I know the young man who started it, Orrin Jacobs, and it's called Men for Choice. And he started that a number of years ago and has been making inroads on campuses. That is also a population to speak to. And we do that. We speak to youth groups, we speak on campuses, and let people know that this is not just a women's issue. This is an issue that affects families. If you have a loved one, if you have a relative who is carrying a much wanted pregnancy that is non-viable and has to wait for some legal team to decide how far along the risk is until she can receive miscarriage management, then you are also at risk. Families are at risk. We point out that as a result, there's a strong correlation between restrictions and the high rate, and increasingly high rate, of maternal and infant mortality. And the numbers are astonishing. I mean, we are the highest in the developed world. And so that's something that we talk about. We talk about it not just in terms of rights, but we talk about it in terms of healthcare. And we often say to men who are opposed, and we do speak to groups that are opposed to abortion in principle as a right. Okay, your wife is carrying your much wanted pregnancy, but she's becoming septic. Do you want to wait till she's on life support and in danger of not surviving? And they begin to look at it differently. They all think of abortion in terms of choice. And what we're trying to do is change the vernacular. I mean, we are working hard not to persuade people not to use the term choice. Ectopic pregnancy is not a choice. Miscarriage, mismanagement is not a choice. So as someone who, was around in the 60s when we thought there was a great term, my body, my choice, we are beginning to understand that you can win over more people by explaining it in the context of healthcare.
I want to pick up on this and just echo, everything that's been said. And, I also really want to help. I think one of the drivers of our campaign is to get away from language of choice for all the reasons you've said. And because, you don't have a choice if you don't have access to choices. And to go back to what you said, Bethany, about who's most impacted by abortion bans, if you can't access reproductive health care, there's no choice. And so I think the choice language also, I think it lives deep in our consciousness, and then it further emboldens pro-life language because we see them as pro-choice, pro-life, and to see that moral high ground is just, I think the language is critical here. This is about access and freedom and all of the things that my colleagues have said. And and in terms of bringing in new people, yes, I could speak to, we're working with Hillel right now. Our goal is to have, I sent a poster and materials for access to every Hillel across the country, hoping that they'll share them with their colleagues, like the other chaplains' offices on campus, so that it's in interfaith spaces, in terms of, getting to young people. I'd also say, and I do this in my own practice, and this is what I tell people, if you're thinking about how to bring new people into the movement, if this isn't their core issue, I mean, you know, I think again, like people need to make it very clear how this is threats to birth control. We're not just talking about threats to abortion access, or like we said, you know, threats to miscarriage care, threats to IVF and infertility treatments. I mean, it's
Right.
all on the line. And so I think making that fully realized for people, just, you know, I talk to the parents at the bus stop when I'm like, these aren't people who are advocates. They don't do social justice like I do. They don't even know Jewish people. Like, they're not like, they're just the people that just try to seed it into conversation, and as much as I can, and offer, oh, maybe instead of, in addition to, you know, the end of year gift, why don't we give a donation to our local fund, our local abortion fund, and just try to get whet people's appetites with like the next step they could take to get involved, whether that's a yard sign, making a donation, signing on to, you know, sending a letter to their local representative. Yeah, I think there's a next small step for anyone we meet and trying to hook them.
Yeah, I was just going to say in Louisiana, we're #1 in a lot of really bad metrics, and one of them is maternal mortality. It's really shockingly high, but I see this as an opportunity for us to work with the Black community on healthcare with that, and they then can work with us on other issues. And, you know, of course, the goal is to help women in general through, you know, increasing access to repro rights, but this also can help NCJW. We have I just see a lot of young people here in the city that want to change things and don't have the avenue to do it, and want to do it in a Jewish way. And this is really an opportunity to tap that energy and grow NCJW and help heal the world too at the same time.
Yeah, I would also just love to chime in and say that education is like so important. And just by attending events like this, I think everyone's doing the right thing. And if people want to get others more involved, invite your friends to these types of events, tell people about what's going on in the community, tell people about NCJW focused, you know, Zooms or whatever. Because I think the more people understand exactly what's at stake, because there are some people that still just, you know, turn a blind eye and don't want to hear about these issues because they think it's not their problem. Like, for instance, many men, you know, we need to mobilize people through education, I think is one avenue to do that.
Rebecca, and I think what you're saying about invitation is really important too, right? It's not a space that men have traditionally been invited into in terms of talking about abortion. And at this point, if we really look at the numbers, the number of men who have been affected in the last 49 years since Roe with abortion, we're talking about a huge percentage of the voting population that has been non-fathers because of abortion. And they too have have had, you know, from many angles that we talked about, how men are involved with abortion. But again, just like opening our spaces so that they're inclusive, and they understand that not only are men welcome, but that their voice is critical, especially to be heard by other men. You know, one of my friends who happens to be an actor became a male spokesperson for Planned Parenthood about 15 years ago, after his wife had her fetus died at 28 weeks. And, you know, he became a very outspoken and was beloved, right? In a way that maybe other men wouldn't have been able to communicate to large audiences like he was able to. So again, working on what we know, but I think that the invitation is really critical to invite folks who have traditionally not been here. And thank you to all the men who are here today, of course. I think that's really powerful and important, that we have many male allies and many male Men for Choice and other organizations that are already allied.
And I'd like to underscore what Shira said about fertility,
Mhm.
because very few people realize that these bans affect assisted reproductive technology. And increasingly, the infertility rates are going up, up, up in this country. And people who may not even be involved with the abortion issue do not realize that assisted reproductive technology is on the line with all these bans.
Right. Right. As we saw with stem cells too, you know. It
Exactly.
also harnesses how we develop our and advance our medical technologies and understandings. Well, we have covered our questions tonight. So let's start taking questions from the audience. We have about 15 minutes. So please feel free to unmute yourself or put it in the chat.
Well, I'll get us started. One of the things I've been paying attention to lately is Governor Newsom's idea for the proposal for the 28th Amendment, which is, I'm sorry, I'm thinking gun control. That's a whole other thing. But anyway, tell me about the amendment. Talk about pro-life. Tell me about the amendment that I can't remember who raised it, but there's going to be an effort for a national amendment. I heard someone raise that during one of the panelists, and I apologize. I blanked on
I
who.
mentioned a state constitutional amendment.
Okay.
And Shira mentioned some national legislation.
Okay.
Yeah, I can speak a little bit to it and direct folks in the chat in just a moment to our legislative center of the National Council of Jewish Women website. There's like two sort of keystone touch points, pieces of legislation in Congress. I've worked in public policy for a long time in Congress, and I sort of call these sort of the generational bills. Like my colleagues who've been working on the Equality Act for decades, like one day it'll pass. And so WIPA and each, I mean, these are both bills that are sort of like the touch point bills. I will drop a link in the chat, but then also, I mean, right now we're like actively working on other bills that tackle different pieces of this and try to, explore all avenues. So like the Black maternal health crisis, pregnancy related deaths are preventable. And so long as people are going in banned states are going to be forced to carry pregnancies, we have to tackle the Black maternal health crisis. There's the Black maternal health, they're calling it the Momnibus. It's actually like a collection of bills in Congress. That was introduced by, I think it is like Alma Adams in North Carolina and Cory Booker.
Lauren, I believe Lauren Underwood was really.
Yeah, exactly. Lauren Underwood. Yes. My Body, My Data Act, which is really about the consequences of apps and websites and the use of the data that we leave behind to be like used against people who are pregnant or seeking information, the right to contraception. I mean, similar to people not, like I already said, the people not realizing how this is going to impact IVF, people, the resurgence of attacks on contraception. And so that is Kathy Manning, North Carolina, and Senator Ed Markey's bill that was introduced already this Congress. And then the Stop and the SAD Act, the Stop Anti-Abortion Disinformation Act, around sort of the amount of disinformation that is out there, and where clinics have gone out of business because of bans, CPCs, the crisis pregnancy centers, like buying up the space, and just the information out there that is just wrong and misleading, and trying to fight that. And then codifying Roe, but that I think that's the long fight, and you all know how Congress is. So we just have to keep chipping away and explore every single avenue, because this is going to impact anyone who ever wants to be pregnant, if they like everything we've already said. And so we have to figure out how to get ahead of it and not allow them to take it from us. And so exploring all avenues is critical.
Yeah, just to piggyback on that for a second, we actually have had a majority in the Congress and the Senate and the presidency, and we haven't gotten equality and we haven't gotten Roe codified. And so I think a lot of internal pressure on the Democrats, only when we are changing state elections via, at midterms, because people are coming out to vote for a constitutional amendment on pro-choice issues, that we have always said this is a national and everybody's issue.
Right.
And the Democrats have never followed through like they could. And so I think that also holding the Dems to that when this becomes a lesser issue or out of the spotlight for 15 minutes and whatever comes into the spotlight for 15 minutes. But this is something where we could have made a lot more progress over the last 30 years and we haven't. And I think that that's really important to remember, that it's not just a given of getting our party generally elected. It's on top of that, making sure that folks really keep this at the forefront.
Yeah. And I mean, I think that especially going into an election cycle, we're going to see this being like the issue that everyone's going to run on because it's a winning issue. Then the work is the get out the vote work that Gail is saying in the voter registration. Absolutely. And then after the elections, and right now, even I have 2 friendly senators and I live in Northern Virginia. Like I have friendly elected officials, and I once a month send my members of Congress an email as a person of faith. I want to know that I am watching and holding you accountable for keeping this issue on your agenda. And I think that's something we can all do no matter where we live, of holding our elected officials across the aisle know that. And I think that's when we are people, the people of faith are watching. I think that is critical, and coming together to say that loudly to our members of Congress.
I will add to that, the namesake for this initiative, my mom, one of the things she always said was, doesn't matter if they're for it, you need to call. So call Representative Pelosi, your Speaker Pelosi at the time, because they log that and that helps. So even if you're very blue state, very Democratic, still call and ask them to do whatever issue, and in this case, the reproductive health care.
If I could pop in, because a question that I get a lot living in abortion hostile state is in a state like mine do. And maybe it's because I'm a state policy advocate and I'm fiercely protective of our 501c3 status. I'm not going to talk about which parties, but I cannot emphasize too much how important it is to get legislators elected who support the issues that you care in.
Right.
And in this case, access to, if you're not in a state like mine, send money. We hire canvassers. The most effective thing, I mean, it's been proven across the country, but especially on an issue like this, going door to door, talking to people about abortion and why it's important, and doing that destigmatizing one painful door at a time is really the way that we try to shift our elected officials back to a point of sanity. So to the extent that you are able to convince people who say, I don't want to go door to door, it's scary, I'm not a people person, like that's what we told ourselves for 50 years. And now is the time to get out there and literally walk.
Thank you, Amy. Any other questions? We've got 5 more minutes. Yeah, Teddy. Sure, maybe you can answer this question in the chat, which is whether we have any language for anti-abortion opposition.
Yes.
Yeah.
Oh, yeah, Sylvia, why don't you take the question? I'm going to drop a language best practice guide in the chat while you feel free to.
We call them forced birthers. And that is, we believe, the appropriate term. Even, Congressman Sewell said that in the beginning. He said government mandated births. So we call them forced birthers. And we argue that there is nothing more pro-life than caring about the lives of pregnant persons, the health and lives of pregnant persons. So we turned it around, but definitely forced birthers.
Yeah. And I will sometimes, it depends on sort of who I'm talking about, but anti-abortion, forced birth, anti-choice. It really depends on the context, but yeah, the flipping the script feels really important.
One thing, if I may, kind of shifting back to the action and coalition building is, there are people here from, obviously I see people who have St. Louis in their title. So there are folks on here, actually a friend of mine who is in Jefferson City and is interested in meeting folks in NCJW, St. Louis, Missouri. And I'm sure there are others on here that may be from around New Orleans. And so this is a good opportunity to connect and maybe put information in the chat about how people can contact you. And that way we can continue with the outreach. And, again, one of the biggest goals here is action, call to action and finding ways to involve as many as we can and educate. Thank you. Thank you for doing that.
I want everyone to have a chance to look at the chat for all of the good resources that have been added to it. So feel free to scan and copy and paste. And echoing what Rachel just said, connect with one another. Tap in. There's a lot going on. There's a lot of human resources needed. There's a lot of financial resources needed. There's a lot of intellectual resources needed. So whatever you have to offer, you're bringing a gift to the movement. And I want to thank everybody for being here tonight with us.
Thank you. Thank you all for your time, for your expertise. It really was very, very beneficial. And this is very important. And to also to add on to your point, I'm saving the chat. So there's a way to save it so that we can share that. We're also going to share the recording. So for those who missed some or know people that wanted to attend who couldn't make all of it, who couldn't attend at all, we will be sending that around as well.
Thank you.
Thanks, everyone.
Thank you, everybody, for a wonderful evening.
It was a great program. Thank you very much.
Thank you.
Thank you.
Thank you, Rachel, Bethany, Sylvia, all that spoke.
Thank you for sharing.
Thank you.
Thank you so much.
Hello, Antonia, you made it. Pleasure.
Thank you.
And good. Well, have a good evening. And Sylvia, we look forward to seeing you in person soon in the East Bay.
I will. I'll let you know.
And same goes for all of our other colleagues now and friends. If you find yourself in the Bay Area, please let us know. We'd love to spend time with you and roll out the red carpet for you.
Looking forward.
Have a good night, everyone. I have a dog who has to go to the bathroom.
Fair enough.
Run.
Good night.
Take
Thank
care.
you all.